Most people believe that if you want to lower your blood pressure, you have two choices: medication or exercise. Take the pills your doctor prescribed or get on a treadmill 5 days a week. The pharmaceutical approach or the fitness approach. For years, that's what I told my patients too. Then I met a woman named Margaret, 73 years old, blood pressure readings consistently in the 160s over 95s, pre-diabetic, medications making her dizzy, and knees so worn down that walking to her mailbox left her in pain for hours. She looked at me across the exam table and said, "Dr. Wells, you're telling me to exercise more or take more pills. I can't do either. Is there a third option, or am I just supposed to wait for the stroke?" That question changed the entire trajectory of my practice, because the answer, the one I didn't learn in medical school, was yes. There is a third option, and it's been hiding inside your body this entire time. My name is Dr. Harrison Wells. I'm a cardiologist with 17 years specializing in hypertension and metabolic disorders. And today, I'm going to introduce you to the most underutilized blood pressure regulation system in your entire body. It's called the vagus nerve. And when you learn to activate it correctly, you can lower your blood pressure without a single medication increase, without a gym membership, and without putting stress on joints that may not be able to handle it anymore. Now, before we go any further, I want to be absolutely clear about something. If you are on blood pressure medication, do not stop taking it because of anything you hear in this video. What I'm going to share with you are techniques that work alongside medical treatment, not instead of it. This is about giving your body additional tools, not replacing the ones that are already keeping you alive. Here's what nobody tells you about blood pressure. Your body doesn't want it to be high. High blood pressure is not a design feature. It's a stress response that got stuck in the on position. Think about it like a car alarm that went off once because someone bumped your car and then never turned off. It just keeps blaring day after day, draining the battery, annoying the neighbors, wearing out the system. Your cardiovascular system is that car. The alarm is your sympathetic nervous system, the part responsible for fight or flight. And somewhere along the way, that alarm got stuck. Medication tries to override the alarm by force. Beta blockers literally block the receptors. ACE inhibitors interrupt the chemical chain. Diuretics drain fluid to reduce pressure mechanically. These approaches work, and for many people, they're absolutely necessary. But here's what they don't do. They don't turn off the alarm. They just make it quieter. The vagus nerve is different. The vagus nerve is the off switch. Let me explain what the vagus nerve actually is, because most people have never heard of it. And the ones who have think it's just some random nerve somewhere in the body. The vagus nerve is the longest cranial nerve in your entire body. It starts in your brainstem and wanders. That's actually what vagus means. Wanderer, down through your neck, into your chest, around your heart, through your diaphragm, and into your digestive system. Along the way, it touches nearly every major organ. Your heart, your lungs, your stomach, your intestines. It's like the body's internal communication highway, constantly sending signals back and forth between your brain and your organs. And here's the critical part. The vagus nerve is the primary pathway of your parasympathetic nervous system. That's the rest and digest system, the opposite of fight or flight. When your vagus nerve is active, your heart rate slows, your blood vessels dilate, your blood pressure drops, your digestion improves, inflammation decreases, your entire body shifts out of stress mode and into healing mode. Now, here's where it gets interesting. In most people with chronic high blood pressure, the vagus nerve has become underactive. Not broken, not damaged, just underused. It's like a muscle that's atrophied because nobody's been exercising it. The sympathetic nervous system, the fight or flight side, has become dominant. It's running the show 24 hours a day. Your body is stuck in a state of chronic activation, chronic stress, chronic emergency mode. Even when you're sitting on the couch watching television, even when you're sleeping, The alarm is still going off, and your blood pressure reflects that. Studies show that people with hypertension have measurably lower vagal tone than people with normal blood pressure. Vagal tone is basically a measure of how active and healthy your vagus nerve is. Low vagal tone equals high blood pressure. High vagal tone equals regulated blood pressure. The good news, and this is the part that changes everything, vagal tone can be increased. You can strengthen your vagus nerve the same way you strengthen a muscle, and you don't need a gym membership to do it. Let me tell you what happened when researchers started studying vagus nerve stimulation for blood pressure. There's a procedure, it's been FDA approved since 2005, where doctors surgically implant a device that sends electrical pulses to the vagus nerve. It was originally developed for epilepsy, but cardiologists noticed something remarkable. Patients who had these devices saw significant drops in blood pressure. We're talking reductions of 15, 20, even 30 points systolic in patients who had failed every medication protocol. The device was literally stimulating the vagus nerve electrically, forcing it to activate, and the cardiovascular system responded by calming down. Now, I'm not suggesting everyone run out and get a surgical implant. That's invasive, expensive, and unnecessary for most people. But what those studies proved was the principle. Stimulate the vagus nerve, lower the blood pressure, and if electrical stimulation works, then non-invasive stimulation should work too. Manual techniques, breathing patterns, physical maneuvers that activate the vagus nerve naturally. And that's exactly what the research has confirmed over the last decade. I'm going to walk you through 5 vagus nerve stimulation techniques that have been clinically shown to lower blood pressure. These are not theoretical. These are not unproven alternative medicine claims. These are techniques backed by peer-reviewed research, many of which are now being taught in integrative cardiology programs. I use these with my own patients, and I've watched their blood pressure readings change in real time. But before I give you the techniques, I need you to understand something important. These techniques are cumulative. They work best when practiced consistently over time, not as a one-time emergency intervention. You're retraining your nervous system. You're rebuilding vagal tone. That takes repetition. Think of it like physical therapy for your autonomic nervous system. The more you practice, the stronger the effect becomes. Technique number 1, controlled breathing with extended exhalation. This is the most researched, most proven vagus nerve stimulation technique in existence. Here's how it works. The vagus nerve is directly connected to your diaphragm and your lungs. Every time you exhale, especially when you exhale slowly and completely, you activate vagus nerve fibers that send a signal to your brainstem saying, "We are safe, we are calm," shut down the stress response. This is called respiratory sinus arrhythmia, and it's one of the primary ways your body naturally regulates heart rate and blood pressure. The problem is, most people breathe shallowly, quickly, and without full exhalation. They're breathing like they're under threat, even when they're not, so their vagus nerve never gets the signal to calm down. Here's the technique. Sit comfortably, back straight but not rigid. Breathe in slowly through your nose for a count of 4. Don't force it, just a natural, comfortable inhale. Then, and this is the critical part, exhale slowly through your mouth for a count of 6 or even 8. The exhalation should be longer than the inhalation. That extended exhale is what activates the vagus nerve. Do this for 5 minutes twice a day. A study published in the American Journal of Hypertension found that participants who practiced slow breathing for 15 minutes a day experienced an average drop of 10 points systolic and 5 points diastolic within 8 weeks. No medication change, just breathing. Technique number 2, cold water face immersion. This one surprises people, but the science is rock solid. When you immerse your face in cold water, you trigger something called the mammalian dive reflex. It's an evolutionary survival mechanism. When your face hits cold water, your body thinks you're diving underwater, and it immediately activates a series of protective responses. Your heart rate slows, blood flow is redirected to your core organs, and your vagus nerve fires intensely to orchestrate all of this. The result is an immediate parasympathetic activation and a measurable drop in blood pressure. Here's how you do it safely. Fill a large bowl with cold water. Add ice if you can tolerate it, but even cool tap water works. Take a deep breath, hold it, and submerge your face for 10 to 15 seconds. Not just your forehead, your whole face, including your eyes if possible. When you lift your head, breathe normally for 30 seconds, then repeat 2 or 3 more times. You can do this once a day, ideally in the morning. A study from the European Journal of Applied Physiology found that cold face immersion reduced systolic blood pressure by an average of 12 points and diastolic by 6 points immediately following the practice, with effects lasting up to an hour. For people who can't exercise due to mobility issues, this is a profound tool. Technique number 3, humming and chanting. This sounds almost mystical, but the mechanism is pure physiology. The vagus nerve runs directly behind your throat and around your vocal cords. When you hum, when you chant, when you sing, you create vibrations in your throat and chest that mechanically stimulate the vagus nerve. It's like giving the nerve a massage from the inside. Additionally, humming extends your exhalation, which, as we already discussed, activates vagal pathways. Here's the technique. Sit comfortably, close your eyes, take a deep breath in, and as you exhale, hum. Any pitch is fine. You should feel the vibration in your chest, your throat, your face. Hum for as long as your exhale lasts. Then breathe in and repeat. Do this for 5 minutes. If humming feels silly, you can chant a simple sound like Om, or just sing along to a song you love. The vibration is what matters. Research published in the International Journal of Yoga found that participants who practiced humming breath work, called Bhramari pranayama, experienced significant reductions in both blood pressure and heart rate after just 5 minutes of practice. One study showed an average systolic drop of 9 points. 9 points from humming. Let that sink in. Technique number 4, gentle massage of the carotid sinus. Now, this one requires a little more anatomical awareness, and I want to be very clear about safety here. The carotid sinus is a small baroreceptor located on the carotid artery in your neck. Baroreceptors are sensors that detect blood pressure. When the carotid sinus senses high pressure, it sends a signal through the vagus nerve to the brain saying, "Pressure is too high, bring it down." You can manually stimulate this receptor with gentle massage, but the key word is gentle. Too much pressure or the wrong technique can cause problems, including dizziness or fainting. Here's how to do it safely. Locate the angle of your jaw, just below your ear. Move your fingers down about 1.5 inches to the side of your neck. You should feel your pulse. That's your carotid artery. Using very light pressure massage in small, slow circles for about 5 to 10 seconds. Do not press hard. Do not do both sides at the same time. Only one side, and only briefly. This is not something you do repeatedly throughout the day. Once in the morning, once in the evening, if at all. And if you have any history of carotid artery disease, stroke, or TIA, do not attempt this without explicit clearance from your doctor. Studies on carotid sinus massage, primarily in clinical settings, have shown it can reduce blood pressure acutely by activating the baroreflex arc, which is mediated by the vagus nerve. This is a more advanced technique, and I include it for completeness, but I want you to approach it with caution and education. Technique number 5, gargling with water. This is the simplest technique on the list, and one of my favorites for patients who feel overwhelmed by the others. Gargling activates the muscles in the back of your throat, which are directly innervated by the vagus nerve. The stronger and longer you gargle, the more you activate those muscles, and the more you stimulate vagal pathways. It's the same principle as humming, but even easier. Here's what you do. Take a mouthful of water, tilt your head back, and gargle vigorously for 30 to 60 seconds. not a gentle little rinse. Really gargle until your eyes start to water a little. That's the sign you're activating the right muscles. Do this 2 or 3 times in a row, twice a day. You can do it when you brush your teeth in the morning and evening. A study from the Journal of Clinical Neuroscience explored vagus nerve activation through oropharyngeal stimulation and found that vigorous gargling increased heart rate variability, a key marker of vagal tone, and contributed to overall parasympathetic activation. Heart rate variability and blood pressure regulation are closely linked. Higher HRV generally correlates with better blood pressure control. Now let's talk about what happens when you combine these techniques, because this is where the real magic happens. Each technique individually has a measurable effect, but when you stack them, when you practice 2 or 3 of these throughout the day, you create a cumulative vagal activation that fundamentally shifts your autonomic balance. You're no longer just putting out fires. You're changing the underlying terrain. I had a patient, I'll call him Robert, 68 years old, retired postal worker, blood pressure hovering around 155/92 despite being on 2 medications. He was pre-hypertensive his whole adult life, then crossed into stage 2 hypertension in his early 60s. His doctor kept adding medications, adjusting doses, and his pressure would come down for a few weeks and then creep back up. He was frustrated. He felt like his body was betraying him. When he came to me, I didn't take him off his medications. I added vagus nerve training. Every morning, he did 5 minutes of extended exhalation breathing. After breakfast, he gargled vigorously for a minute. In the evening, he did cold water face immersion. 3 techniques, 15 minutes total throughout the day. Within 6 weeks, his average home readings dropped to 138/84. Within 12 weeks, 132/80. His cardiologist was able to reduce one of his medications. Robert told me, "For the first time in a decade, I feel like I have some control over this. Let me tell you why this matters beyond just the numbers on the blood pressure cuff. High blood pressure is not just a number. It's a risk factor for stroke, heart attack, kidney disease, vascular dementia, and a dozen other catastrophic outcomes. Every point you lower your systolic pressure reduces your risk. A 10-point reduction in systolic blood pressure is associated with approximately a 20% reduction in risk of major cardiovascular events. 20%. Now imagine achieving that reduction not by adding another medication with another side effect profile, but by activating your body's own internal regulation system. That's not alternative medicine, that's physiology. And the beauty of vagus nerve stimulation is that the benefits go far beyond blood pressure. When you increase vagal tone, you also reduce chronic inflammation. You improve digestion. You sleep better. You recover from stress more quickly. You enhance immune function. The vagus nerve is the master regulator of your entire rest and digest system, so when you strengthen it, everything downstream improves. Here's what I want you to understand about your autonomic nervous system. You have been told your whole life that it's automatic, that it runs in the background, that you have no control over your heart rate, your blood pressure, your stress response, and for the most part, that's true. These systems are involuntary, but involuntary does not mean untrainable. You cannot consciously tell your heart to beat slower the way you can tell your hand to pick up a cup, but you can practice techniques that train your nervous system to default to a calmer state. You can build vagal tone the same way you build muscle tone, through repetition, through practice, through consistency. The autonomic nervous system is not a fixed thing you're born with and stuck with forever. It's adaptive. It responds to input. And the techniques I've given you today are the input. Now I know what some of you are thinking. This sounds too simple. Breathing and humming and gargling are supposed to lower my blood pressure? I've been on medications for 20 years, and you're telling me I should try gargling? I understand the skepticism. I had it too. But here's the thing. Simple does not mean ineffective. The mechanisms I've described, the vagus nerve pathways, the baroreflex arc, the mammalian dive reflex, These are not new age concepts. These are established physiological systems that have been studied for decades. What's new is the application. What's new is the recognition that we can access these systems non-invasively and use them therapeutically. Medical schools are starting to teach this. Cardiology conferences are hosting sessions on vagal maneuvers. The Cleveland Clinic has an entire integrative cardiology program built around these principles. This is not fringe. This is the leading edge of cardiovascular medicine. Let me give you a framework for integrating this into your life, because I don't want you to leave this video inspired and then never actually practice any of it. Information without implementation is just entertainment. Here's what I recommend. Start with one technique, just one. Pick the one that feels most accessible to you. If you hate cold water, don't start with face immersion. If you feel self-conscious humming, start with breathing. Choose one technique and practice it every single day for 2 weeks. Set a reminder on your phone. Tie it to an existing habit. Do your extended exhalation breathing every morning right after you make your coffee. Gargle every time you brush your teeth. Make it so automatic that you don't have to think about it. After 2 weeks, if you're comfortable, add a second technique. After a month, add a third. Track your blood pressure at home. Get a reliable home monitor and take readings at the same time every day. Write them down. Watch the trend. You're not looking for overnight miracles. You're looking for a gradual, sustained downward trend over weeks and months. Here are 3 questions I want you to ask your doctor at your next appointment. Question 1. Can you review my current blood pressure readings and help me set a realistic target range? This establishes a baseline and a goal. You need to know where you are and where you're trying to go. Question 2. Are there any medical reasons I should avoid vagus nerve stimulation techniques like cold water immersion or carotid massage? This is a safety question. Most people can do these techniques without issue, but if you have certain cardiovascular conditions, your doctor needs to clear you first. Question 3. Would you be willing to monitor my progress over the next 3 months as I incorporate these techniques and adjust my medications if my blood pressure improves? This question does 2 things. It makes your doctor a partner in the process, and it opens the door to medication reduction if your numbers improve. Some doctors will be enthusiastic. Some will be skeptical but willing to monitor. A very few will dismiss it entirely. If your doctor won't even entertain the conversation, that itself is information worth having. I want to take a moment to talk about what this is not. This is not a miracle cure. This is not a replacement for necessary medication. This is not going to take someone with a blood pressure of 180 over 110 and bring them down to 120 over 80 in a week. If your blood pressure is severely elevated, if you've had a cardiac event, if you have end organ damage from hypertension, you need aggressive medical management, possibly including multiple medications, and these techniques are adjunctive. They support medical treatment, they do not replace it. But for the millions of people whose blood pressure is in that gray zone, 130s, 140s, 150s, people who are on 1 or 2 medications but still not at goal, people who are experiencing side effects from their medications, people who are pre-hypertensive and trying to avoid crossing into hypertension, this is a game changer. This gives you agency. And agency, the feeling that you have some control over your health, is itself therapeutic. Let me tell you about the moment I truly understood the power of this approach. I was working with a woman named Diana, 71 years old, lifelong anxiety, blood pressure that spiked every time she came to the doctor's office, classic white coat hypertension. But her home readings were high too, not just at the doctor. She'd been on medications for 15 years. She told me she felt like her body was always vibrating, always on edge, always waiting for something bad to happen. I taught her extended exhalation breathing and cold face immersion. 6 weeks later, she came back for a follow-up. I took her blood pressure in the office. It was 146 over 88. Not terrible, but not great. Then I asked her to do 3 minutes of the breathing technique right there in the exam room while I watched. Slow inhale, extended exhale, over and over. After 3 minutes, I took her pressure again. 131/79, 15-point drop in 3 minutes. She stared at the reading, then looked at me and said, "I did that. My body did that." And I said, "Yes, you did." That moment, that realization that her body had the capacity to regulate itself when given the right input, changed everything for her. Not just her blood pressure, her entire relationship with her health. Here's what I need you to understand. Your body is not your enemy. High blood pressure is not a personal failing. It's a sign that your stress response system has been overactive for too long, and your rest response system has been underactive. The beauty of the vagus nerve is that it gives you a direct line to that rest response. You don't need to understand all the neuroscience. You don't need to be able to pronounce parasympathetic. You just need to practice the techniques. Your body knows what to do with the input. You breathe slowly, your vagus nerve activates. You immerse your face in cold water, your dive reflex kicks in. You hum, your vocal apparatus stimulates vagal fibers. These are hardwired biological responses. You're not creating something new. You're activating something that's already there. I want to leave you with something genuinely hopeful, because hope is not just an emotion, it's a physiological state. When you believe you have some control over your health outcomes, your stress levels drop. Your cortisol decreases. Your vagal tone increases. Hope is therapeutic, and the techniques I've shared with you today are reasons for hope. Every single one of them has been studied. Every single one has shown measurable effects on blood pressure, on heart rate variability, on autonomic balance. You have more control over your cardiovascular health than you've been led to believe. Not total control. Nobody has that, but significant, meaningful, measurable control. The vagus nerve is the pathway. These techniques are the tools. Your consistency is the variable that determines the outcome. Let's bring it all together. 5 vagus nerve stimulation techniques that can lower blood pressure naturally. Extended exhalation breathing, 5 minutes twice a day, clinically shown to reduce blood pressure by an average of 10 points systolic. Cold water face immersion, 30 to 60 seconds once a day, shown to activate the dive reflex and drop pressure by 12 points or more acutely. Humming or chanting 5 minutes daily, demonstrated to reduce blood pressure and increase heart rate variability. Gentle carotid sinus massage, done carefully and briefly, can activate the baroreflex and lower pressure in the moment. And gargling with water, vigorously for 1 minute twice a day, stimulates vagal pathways through throat muscle activation. None of these require a gym. None of these require expensive equipment. None of these put stress on aging joints or require cardiovascular fitness you may not currently have. They require only consistency, a few minutes a day, and the willingness to try. What I want to know from you is this. Which technique are you going to start with? Are you a breathing person, a cold water person, a humming person? Tell me in the comments. I read every single one, and I genuinely want to know what resonates with you. And if you've already been practicing any form of vagus nerve stimulation, what have you noticed? Have your blood pressure readings changed? Has your stress level shifted? Share your experience, because your story might be exactly what someone else needs to hear to take the first step. If this video gave you a new understanding of how your body regulates blood pressure, or if it gave you practical tools you can use starting today, share it. Share it with someone who's struggling with high blood pressure. Share it with someone who's been told exercise is the only non-medication option but can't exercise. That one share could change someone's trajectory.